Welcome to the meeting room at Global TV Talk Show, a broadcast service of globalbusinessnews.net.
Now, here's your host, Ed Cohen.
This is Ed in San Diego, and you're on Global TV Talk Show, a business unit of globalbusinessnews.net, which has been around since '03. Google Analytics says that since '03, we've had a little over 1 million reader page views. And more relevant, since the pandemic crashed and burned our live conference business around March 1 of 2020, we started to do Zoom meetings, and here we are. And we've done about 200 broadcasts, and Google Analytics says that our page count, audience page views, as they call it, has been just under 125,000. Today, we're with David Hall, who's an old friend, and we've had a few encounters on radio and now TV. And he is an expert in the digitalization, that's a mouthful, the doctors going digital. Let's welcome David Hall. Hello.
Thank you, Edwin. Yes, great to be back again, and to be part of your growth and success and everything you're doing over the past few years.
Well, thank you. It's really great to reconnect with you. And you're going to be a part, this show will be part of our growing, fast growth medical TV talk shows. So far, we've done 4 broadcasts under that banner, spread out over a few months. The doctors and researchers are kind of hard to pin down, so we have to wait for their schedule. I'm associated as a marketing guy with a charity based in Southern California called FindNeuroHelp.org. And this is all about Alzheimer's and Lou Gehrig's disease and also Parkinson's. My role to date is in PR and making the marketplace aware of the good work that they do. And so I'd like to make that connection for you. So your specialty is in taking digital, the world of digital, and everything connected with that vein, and applying it to a much needed place, doctors. Okay, so David, I'm going to stop talking. Would you please introduce yourself much better than I did just now, but in more scientifically? You have a lot of letters after your name. You're highly educated and very experienced, living and working in 40 countries, and you're focusing in on the healthcare industry, doctors, hospitals, medical associations, because it's never been more apparent for the need for digitalization of not only customer communications, but record keeping, right?
Yeah, that's right, Edwin. I started my career, I like to say, in a previous lifetime at Indiana University Medical Center as a hospital medical center administrator. Was in the MHA Healthcare Administration program there. Later on to Harvard in a different area, but I also worked with Harvard affiliated hospitals. And then for about, I won't say how many years, a couple of decades, working in the technology area, working in health tech, med tech, related biotech. So everything related to what we're doing now held Fortune 100, Fortune 500 management positions. And then to bring you up to date, as you mentioned, involved in digital health innovation. And what we do is we're placing doctors at the center of digital health innovation. They've kind of been overlooked. Doctors have always been the leaders. They've always been inventors and innovators. And with digital health, they've kind of been left out. It's caused a lot of stress. It's caused a lot of burnout, like it has for everyone. But it's been especially difficult for doctors. And by placing them again at the center of the digital health innovation, we can improve patient care delivery, patient outcomes, we can reduce costs, we can improve value-based healthcare, and now digital value-based healthcare, because it's with the converging technologies, it's now possible to reach some of the goals of value-based healthcare.
Okay,
And
what
that's
does
we're
this
doing.
mean? Okay,
Okay.
let's go to plain English. What is value-based healthcare?
So essentially, there are new measurements every day, and some of it comes from government regulation. Some of it comes from hospitals needing to reduce their costs, to be more efficient, to improve outcomes, patient care delivery. And when you're looking at health and wellness and patients, now it's becoming about preventative wellness. It's about reducing risk. And as part of these measurements are changing, kind of like I like to give the analogy of even social business, social enterprise. What you're measuring in healthcare is completely different. In social business, social enterprise, you're measuring the social impact. With healthcare, you're measuring wellness, and now you may be measuring patient satisfaction. You may be measuring various aspects of wellness, and it's very challenging. There are some measurement platforms out there. There are checklists and things like this to try to measure exactly what is value, and what is the value to the patient. If you're reducing risk, say you're using artificial intelligence. If you go to the hospital, you don't acquire an infection called a nosocomial infection, right? A hospital acquired infection. What value is that to you? Or if you don't have an adverse drug reaction, what value is that to you? And if you're using AI, are you willing to pay for it? Is the hospital going to pay for it, or the provider going to pay for that? Because you have reduced your risk. You didn't get an infection, or you didn't get sick, or God forbid you didn't die from a wrong prescription. What value? Who's going to pay for that, and how can you measure the value? So that's a big part of what we're doing with the doctors. So this is for the doctors to do. So I want to emphasize they're at the center of these innovations.
So the doctors have to, or their staff have to input data in order for your digitalization to take over.
Yeah, we've got a very different approach, actually. It is about data. So there is data. There's different types of measurements that we're doing, applying scientific models and proprietary approaches, because the measurement is so different. And with doctors, yeah, it may be some the entering data, but it's more the design thinking that we talked about, a few years ago. We're bringing that to doctors, so they're using design thinking processes and mindsets, exponential thinking, which is digitization, the 6Ds. Other types of innovative thinking, and then we have an out-of-the-box ecosystem that empowers the doctors to be able to do all this in this accelerating digital era.
This is fascinating stuff. So let's jump off this rail and go back to the beginning here. Your company, TAMP, what is TAMP?
TAMP came together. I mean, this is something we were working on for many years before, 2 years ago when we founded this U.S. corporation. But it's really become part of a movement. We're now a core team of 10. We're an extended team of about 80, including founding advisory doctors, diverse experts in various areas of technology and healthcare and business. Because it really required diverse groups from around the world coming together to solve very serious pains in healthcare. We're an extended medical association strategic alliance with 65,000 members and growing. We have numerous healthcare institution partnerships. And after 2 years, I feel like this is just the beginning, because the pains that we're solving are so big. The goals are so big and massively transformative.
So the doctors and they're on the medical, it's called doctors in medical. Okay. They're the source of your information, right?
Yeah, it's the doctors, right, are the human capital. So they are it's still patient-centered care. It's still focusing on the patient outcomes. However, our approach is a bit different because we're focusing on the doctors, right? It's the knowledge they have. It's the know-how, the skills, and we like to say real life experiences. That's the key. So these are doctors sharing their real life experiences with other doctors. And we have a program called DIUP. It's Digital Innovation Upskilling Program. It's a 12-week program for doctors. It's the only one of its kind where doctor, innovator, facilitators, digital influencers, doctors who are already using these digital health applications are sharing their experiences with other doctors. And then it goes on and so on and so on, and builds this sustainable ecosystem within the medical institution and within the healthcare, within the medical association and within the healthcare institution.
So my medical provider is Scripps here in San Diego, Scripps Medical, which is sort of like it's high level, sort of like a Harvard. And you know,
Woods Hole and Scripps, part of the Scripps, affiliated with Scripps Institute, right?
It goes way
Marine
back.
Ocean.
A very philanthropic family of hundreds of years, I think.
Yes.
So anyway, San Diego's a big STEM center and funded, UCI, UC, University of California, of course, is part of that. But Scripps, anyway, they have, and UC system has this too, but so they have this patient communications program, which is super easy and really effective. Like just this morning, I sent a message. It's almost like an internal text, okay? But once you get in their system, identifies my doctor and a non-urgent medical question was my headline. And then my topic was, so I've had both Moderna, but going back to last February, and I want the booster. Can I get it in CVS or Walgreens? Walk in and get it? Or do I have to wait? And also, second question, I've had Moderna, but is it all right for me to get the Pfizer? That seems to be the only one, but so I'm confused. Help me out. So it took like a minute, and the technician or whoever was at the keyboard sent me back a message, says, you don't need it. It's primary at the current stage. It's just the booster is just for immunocompromised people, and you're not there, thankfully. So, but you said, go get the flu shot, go get this and that, and be patient. And so that system of instant communications is got to be part of what you're talking about, because I'm talking with others about this system and they don't know about it.
Yeah, it's definitely, and that presents new challenges. We have a lot of doctors, we're talking to them every day. Some give their mobile phone number and get text messages, and managing all of those communications. It's great, right? They can get the instant feedback, but how to capture all of that data and then keep that data, right? So everything's about the big data. And so with these communications, from our position, it's doctors at the point of care, the doctors that have these pains, solving their own pains like no one else can, using human-centered design thinking, and innovating solutions to what you're talking about. So we talk to the doctors, and right, they may say, I'm getting these questions, and I answer them, and then how might I innovate a solution for that. And then they can go through the entire process to co-design, co-create, and then distribute, co-design, co-create in our innovation hub called InnovaHub, then distribute in our marketplace. And it's a revenue sharing model. So doctors can be incentivized not only for sharing their knowledge in the DIUP program, they can be incentivized to have additional streams of revenue for innovating what you're talking about. These types of things, because they're right there, they're the ones that see it, and they're the ones that know best how to innovate a solution for that.
So are you talking about now data as a result? Okay, so I go to the doctors and I have a physical, I mean, live. And so all the tests, blood tests and everything. So that's all computerized, and I can go into my Scripps Care thing and, in a week or less after the appointment and see everything. And Dr. Heller is sending me messages about you need to do this and blah, blah. And so they're not in the record forever. And any doctor, if I happen to have an accident in Aruba or Taiwan or wherever, a doctor is going to have access to that. Is that the kind of interoperability, data interoperability that you're talking about doing?
Yeah, well, we work with, we have, hundreds of partner providers that do a lot of the things that you're talking about. So we work with carefully selected partner providers in long-term sustainable relationships. And then those emerging tech companies that you're talking about can work together with our doctors to co-design and co-create to make improvements, because the pain is, and even with IBM Watson Health, the digital giants, Google Health, they even admit that they failed because they were taking the technology approach. So they create the technology and push it out like they always did, without involving the doctors in the human-centered design. So what our ecosystem does, and on our platform called DHIP, the Digital Health Innovation Platform, is to bring these folks together to solve the pains together. So we're not providing those types of systems that you're talking about, but it's improving them, and hopefully co-designing, co-creating from the very beginning. Or if they have, like say, a virtual reality, just to give you an example, the doctors can co-create, because there's not much content, right? There's 80% of what's being sold is hardware. So it's the doctors as the expert advisors contributing to co-developing that content, and we bring those folks together to do that.
Interesting. Wow. So do they have to program in, send messages into something, or is it a system that you just plug into and all of a sudden there's data populating different things?
Well, ours is more about it's more about the innovative process. So they would not actually be entering data, but they would be co-designing and again co-creating these new innovations together with our emerging technology partners. And it begins with, there's all these different intelligences, right, that they're talking about. Now we have digital intelligence, or DX, some they're calling it. So we build the awareness with the doctors. It's digital literacy skills, digital intelligence, and again, real world experiences from other doctors, and applying those real world experiences. And that's where it begins. And if you don't do this with the proper, change management, adding the technology can be a failure, and the failure can be worse than having done nothing at all. So We also include in this various types of models and approaches, change management, to ensure that the adoption of the technology is successful. So we empower doctors, we engage patients through corporate wellness. It's about adoption of the technology and innovation.
Hi, this is Ed, and I thank you for tuning in to Global TV Talk Show, a unit on globalbusinessnews.net. We broadcast to the world, as you know by now. So I wanted to make sure that you understand that our programs are advertising supported. We're grateful for co-sponsors, advertisers. They have a marketing budget coupled with a strong desire to be associated with our top quality program. And of course, I'm grateful. Thank you. So for the next few minutes, you're going to see some commercials. It's mostly very low key, and our prices are very, very reasonable. Our exposure for the advertisers go 12 months and beyond. Some of our advertisers have been with us since March, April of 2020. And Google Analytics has tracked over 125,000 what they call audience page views, which means you looking at this page, that's a page view. Now, if you happen to go to one of our other shows or to our radio broadcasts or to our newspaper or magazine, those become additional page views as measured by Google Analytics. And so when they say 125,000 since spring of 2020 up through Labor Day, a month ago, that's pretty good numbers. And the past 30 days, Google Analytics has measured just under 6,000 audience page views. And that, according to them, is a 42% increase in audience participation over the month of August. So thank you very much. Well, here's our advertisers, and we'll be back in just a couple of minutes or so, and we'll proceed with this interesting conversation. Thank you.
This episode from the meeting room of Global TV Talk Show is brought to you by
The Bridge School, the accredited international online private school of choice, at bridgek12.org.
Porch Light Rental and Destination Services. Reduce your renter lump sum or managed relocation costs. Visit them at porchlightrental.com.
And by airs.com. With our full range of services, we can help design and manage your international relocation. Find us at airs.com.
Primestone Partners, featuring corporate, government, and developer housing solutions, as well as senior-level advisory services. Find them at primestonepartners.com.
And by International Auto Source. We are the vehicle experts for expats, featuring all major brands of automobiles with flexible solutions and financing. On the web at intlauto.com.
Become a global player in your field.
Cross Culture to Go provides virtual support for your global business and career success.
We can help you thrive in 140 plus countries and markets.
On the web at crossculturetogo.com.
Something that's really neat is that the Bridge School partners with various organizations to provide learning for their students. For example, we partner with a major ballet company, and we are able to enroll several of their students into our school. So now not only is the student able to participate in a school and have a seamless transition while they're very active in their ballet career, but now they have other dancers that are with them that are doing some of the same courses. So it's almost becoming a camaraderie where they're taking similar courses, they're working together on their ballet, and really being able to form this great partnership with these organizations to provide a needed service. A lot of times there are student athletes who will spend hours and hours at the gym or at the basketball courts, wherever it is. And if they're attending a traditional school, they're in school from 8 to 3. They get a quick snack, and then they're at the gym for 3 to 4 hours in the evening. Coming to us and having that partnership, they're able to break that up throughout the day. They can have a morning practice, get some schooling in, have an afternoon practice, finish their schooling in the evening. So there's that flexibility. And additionally, if there are tournaments or performances, it's fantastic because if there's a week where they have shows straight through, they can take that week off of learning and then pick back up when they're done. So it offers this great flexibility. And for the program owners of these sports leagues, it is a win-win situation for them because they see this need. They see this need that their students need to make sure that they are obtaining the grades necessary to be successful adults in our country and in other countries. But it provides them an environment where they can be successful at both.
Hi, I'm Sergey Gorbatov.
I'm Angela Lane.
Together we're researchers, writers and practitioners in the field of human resources.
And we've also been multi-country, multi-assignment career expats.
We owe our professional development and growth to a very large extent to the international assignment opportunities that we have had.
But in a world where distributed work may become the norm, we also want to understand what will happen to the nature, duration, and purpose of international assignments.
Together with our colleague, Julian Dalzell from the University of South Carolina, we're undertaking a study on the future of expatriation.
And we'd value your contribution. You can participate in this important study by completing a simple 10-minute questionnaire.
Access the questionnaire by typing in your browser tinyurl.com/expert study. That's tinyurl.com/expert study. You can also find the link here on ED's website next to this video.
Thank you for joining us in this study. In return for your contribution, we'll provide you with a copy of our research.
And of course, you'll be invited to an exclusive webinar hosted by ED, where we will share our findings right here on Global Business News.
And so please go to tinyurl.com/expat study. Take the survey so that we can better understand the future of expatriation.
So, what about, let's just, I'm a dummy, so I have to just ask simple questions here, but I'd like you to use the platform here for communicating out, because we'll distribute this program to doctors and medical people and researchers for 12 months. And so they'll be part of this medical TV series, because we want to go deeper and take a specific thing that you and I are talking about. I'm listening, and then do a special program on that particular topic and add it to the series. So, are you looking? What's your goal here? Are you looking for associations and hospitals and medical people, doctors, to become a member or something, or to do something?
Yeah, we're growing we work through long-term sustainable relationships. So we have strategic alliances with numerous medical associations around the world, such as the European Medical Association, the High Tech Surgery Associations, and several others. Currently about 65,000 members. There are 8 to 10 million doctors globally, about 30 million to 40 million non-doctor healthcare professionals. So we are looking to build those alliances with additional associations. We also have a new nonprofit called the Global Medical Doctor Validation Association. It's GMDVA. It's at gmdva.org. It's in Brussels, Belgium. And it's formed with one of our partners who is a medical doctor. He's also the president of the EMA. He's a ambassador to the European Union, and very well connected and very smart guy. And we got together a group of us to build not only association alliances, but we said, let's build an alliance of associations, right? Because now you need everybody. You need diverse groups, as I was mentioning, around the world. So we're building this GMDVA. It's to validate doctors. That's a very difficult challenge around the world to validate the credentials. And we do this through medical associations. So we continue to work with them. And then we're vetting various therapies, treatments, and digital health technologies, because that's another huge pain. How do you validate the credentials? So we're looking at doing that on the blockchain. We're looking at ways that we can create a kind of a unique identifier to validate the doctors, because we have global telehealth that we're offering. We have these things. So we need to make sure that the doctors have the credentials, and then that we're able to vet all of the various therapies and treatments around the world. So we have a doctor and scientific committee that's part of that. And so, we're looking for associations to become part of our alliance, and then to become part of this global alliance of alliances, alliance of associations. And then we work with healthcare institutions. We've found kind of the sweet spot is medium-sized hospitals. These are hospitals with about 100 to 500 beds. So they're wanting to innovate, or they're innovating, but they need to do it faster. They need an out-of-the-box digital health innovation system they can plug into. They can bring their doctors into that, and they can start innovating right away. And we have a 3-year plan. So it's a 3-year out-of-the-box ecosystem for medium-sized hospitals. This could be used by smaller hospitals or larger hospitals as well. But that's kind of the sweet spot. And we're working with C-levels, executives at those hospitals. That would be the CEO or the chief medical officer, chief innovation officer, chief digital transformation officer, and CIOs and others at these types of hospitals.
So I want to get some information out to our audience, and I'm just trying to get to your LinkedIn page here, but I'm having some difficulty here. Why don't you just say to our audience out there, what is your website? Or the website they should look at?
Yes, it's a secure website. So, our platform is secure. So please use the https://, and it's www.theampdoctor.com. I'll spell it TheAmpDr.com, theampdoctor.com, or you can find us, of course, on Twitter. We're on dozens of networks: Twitter, LinkedIn, Facebook, Instagram. About anywhere you look, you can just look TAMP, TAMP, and you will see dozens of pages come up on Google under TAMP.
So on the site, I was on the site about 6 or 7 hours ago. So just from memory, it's beautifully designed. I love the orange color and the brightness, and the data is very easy to follow, very simple under the categories. So I really would like to recommend our audience who's interested in this kind of thing, go check it out. So do you want people to contact you?
Yeah, absolutely. Our email is community@theampdoctor.com, or on our webpage, we have a chat on there. We have a chat bot that will come to our community success team. So you can send us an email, or again, on any of the all the social media networks are all plugged in to our HubSpot, which is our sales marketing CRM system. So pretty much anywhere you go and type in TAMP, you can send a message or chat. So we want to be as easily accessible as possible.
Well, this is great. So TAMP is TAMP. And I thank you, David Hall, for being my guest. I welcome you to come back. And I'm going to make a connection for you with this charity, findneurohealth.org. And we'll go from there, because they are connected with several doctors and researchers.
I'd appreciate the intro. We'd love to talk to them. There's
happy to do that.
Crossover areas there we're working on with psychiatrists, and we have doctors that are experts in the physician stress and burnout. So definitely some crossover area there with what we're working on. So that
I've got minutes here before I've got to close, but on stress and burnout, and mental health, keeping sane. I mean, the COVID related stuff is just nuts. It must be impacting all your people.
Yeah, everyone's been hit hard. We've had so many we've had several doctors in our community that have been hit with it. And we've had people on our team. We have locations all over the world. Them or their families. Everyone's been affected by it. We've had, and personally, and then also, from their business perspective, their practice perspective. Clinics down. We've had, as we know, hospitals. 47 hospitals bankrupt last year in the U.S.
I didn't know.
Clinics down, the payments down. So that's, we're looking to find the silver lining in all this, where doctors can innovate. They generate additional streams of revenue, and they're able to, to access the technology they need, and the digital technology. We say, doctors won't be replaced by AI, but doctors with AI may replace doctors without AI. So all of what we're doing, right, is to find the silver lining in this, not only in this new norm, but to prepare for the next inevitable crisis or pandemic, because they've got to play catch up. Healthcare has adopted roughly about 7% of emerging technologies versus about 15% in industry. So we needed to have done that before. Now with the new norm, as we know, it's accelerated by, some say, 5 years, 7 years.
Right.
But we got to keep going and prepare for the next one. So that's where we hope all of what we are doing will have a positive impact.
Thank you again for being on Global TV. You really make my day here. And
I appreciate it, Edwin. It's always great to get
David
together
Hall,
with you.
You be well, and let's stay in touch, okay?
Absolutely.
Great. Thank you. Take care. Bye-bye. Ciao.
Thank you for joining us in the meeting room at Global TV Talk Show.
Have a wonderful day, and stay safe.